From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Thank you very much for tuning to our channel this evening. I want to talk a few minutes about healthcare proxy. Basically, healthcare proxy is an instrument or document that allows a patient to appoint an agent to make healthcare decisions in the event that the primary individual is incapable of executing such decisions. So once the document is drafted, the primary individual continues to be allowed to make healthcare decisions as long as they are still competent to do so. So if I am the primary individual, I appoint somebody to make healthcare decisions in the event I become incompetent. So that person becomes my healthcare proxy. And it's not mandatory. And it's just to follow the wishes of the patient whenever they become incapable of communicating their wishes. So I appoint a healthcare proxy to do my wishes whenever I become incapable or incompetent to do those decisions. So healthcare proxy, they should be like 18 years old, and they should be most often, they should be a little bit close who can read my mind in case if it is a situation which is completely surprising. Now, primary individual, many times the agent, they get an agent, and the agent has power to remove or sustain tube feedings from the primary individual if these tubes are the only things that are keeping the primary individual alive. So you say, for example, if I don't want to be on tube feeding, and I should write it clearly on my healthcare document, and that healthcare proxy document will be followed, and I can make a person as healthcare proxy. And when at the time when the doctor has to decide about my tube feeding, what I wrote on the form takes precedence than what that healthcare proxy person wants to do. In other words, if I put my wishes solidly on a paper, on a document, and that will carry more weight than a person whom I appointed as my healthcare proxy. So you see, it can become a controversial thing sometimes. For example, if I make my primary care physician who is taking care of me continuously, can I make him as my healthcare proxy? In some case, in some states you are allowed to do so, but in majority, like 39 states have enacted laws that forbid the appointment of treating physicians as healthcare proxies. So my primary care doctor in many states cannot be my healthcare proxy. Why? Because as I can have my own personal wishes, but my primary care doctor may have professional values. You see, many times doctors who are treating us will have professional values. They may not they may not make a choice based on patient's personal values. They might make a choice based on their professional values, which might be in direct conflict with the personal values. That's why in many states you cannot have your own family doctor as your healthcare proxy, but there are also people who say that is just reducing the freedom of choice from the patients. Now, the structure of typical healthcare proxy form in the United States, it differs from state to state, and but pre-made forms are not compulsory as long as certain guidelines are met. So most often there will be the name and address of the agent, then the name and address of the alternative agent, that is the healthcare proxy, Then duration of the proxy, not indicating a duration means its value unless stated otherwise. It's valid unless stated otherwise. So you say the duration, then you give the powers, any specific instructions, like you can say, I don't want tube feeding, I don't want dialysis, I don't want chemotherapy, I don't want this and this and this and this. You can specifically give instructions, and they will have their weight. And that's the best way to do it, is to write the things you don't like on your healthcare proxy form. That's the best way to do it. Then you should always also put the signature. Then you should also put 2 adult witnesses. These 2 adult witnesses, they should document, testifying they have witnessed this agreement, and that both parties appear to be sane and competent to do so. And the 2 adult witnesses should be more than 18 years old, and they should sign it, and then you have those copies. And it should be done in the presence of a lawyer who will prepare these documents. And then you make copies, and you give 1 copy to the patient, 1 copy to the healthcare proxy, 1 copy to the family, 1 copy to the doctor, 1 copy to the lawyer. So that is how it works, folks. So basically, healthcare proxy is somebody you appoint to take decisions whenever you become incompetent. Contemporary importance, there is so much. Healthcare proxy have become increasingly mandatory due to conflicts among relatives of the primary individual. You see, you remember back in 2003, I think, Terry Schiavo case in Florida. Terry Schiavo, she was on tube feeding for like 10 years. And doctors concluded that she was in a persistent vegetative state. And her husband, he wanted to remarry. So he did not want Terry Schiavo to continue on tube feeding. And he wanted to remove the feeding tube, but parents of Terry Schiavo, they objected. They wanted to feed their daughter indefinitely. So the husband and the parents, they were in big conflict. And the conflict, it became a national conflict between pro-life and pro-choice, Democrats and Republicans, and it went up to the White House. There was a Florida legislature, Florida Supreme Court was involved, United States Congress was involved, and there was President Bush, United States President at that time, was involved. So all these people, they became involved because it became an ideological conflict. Some people wanted to be on parents' side, some people wanted to be on the husband's side. That is how it went. But the whole episode might have been averted had Terry Schiavo signed a healthcare proxy document or had appointed an official healthcare proxy. But she didn't do it, and it resulted in so much conflict and confusion. So healthcare proxy is a very good idea because you are appointing somebody to take healthcare decisions in your place, and that saves a lot of confusion. And life is very trivial, and it can come to a screeching halt at any moment. So it's a very important thing, and it's a very good idea to have a healthcare proxy. That's about today's topic, and if you have any important points, please feel free to post them on our website or comment sections. Thank you.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless bless you. Are you preparing for USMLE? Please do not waste thousands of dollars on training courses. Get the books written by Dr. Paul with the student-to-student tips and memory aids. The success will be yours, and you will soon realize your dream of becoming a physician in the United States. If you are preparing for Step 2 clinical skills, study USMLE Smasher, a guide helping thousands of medical students to pass this examination. For more information, visit us at www.drpaul.org.